Good morning, Mr. Chairman, friends, ladies and gentlemen. First of all, let me thank my colleagues here in Sofia for the kind invitation and asking to deliver the talk. Can I have it in here? Yeah. I believe this is a mixed audience, and my Bulgarian language is zero, so I'll be talking in English, and I hope it is not something difficult. Trauma has a wide variation in presentation from place to place, as we are from the developing world. So the trauma is not still so common. It's almost a third in our commonality. While in the developed world, it is number one. However, there is a projection that by 2020, it will be number one killer in the world. We know that whenever there are disasters, 22% children, they are at risk, whether there is an earthquake, tsunami, and other things. But surprisingly, about 1 million deaths occur because of the trauma. And 95% of these deaths are in the developing world. So that is a real. But most importantly, that all these are preventable. So how is the child different? Child being inquisitive, so naturally he has the interest to just reach to any place at home or outside and gets accidents. Total impact over a smaller area, lesser protective fat, big head, and of course internal organs are much larger in the abdomen and so are more prone for. But interestingly, as you all know, that bones being flexible, so there could be a major trauma, but less fractures. And that is the reason there could be splenic fracture, pulmonary injuries, and without fracture of the bones. How it is different from the West? In our setup, 80 to 90% is a blunt trauma, 10% almost penetrating. But the uncommon modes, can I have a pointer? No? Okay. On the right side, the uncommon modes. Our is an agriculture dominant country, so agriculture tools fall from the height because they are interested in kite flying, which is very common in our setup. Bicycle handle injuries, trapped in wall collapse, fall from the bullock carts and fall in the well, deep well. Sometimes it also happens. In 50% cases, there is a polytrauma, multiple organ involvement, and extremities get involved in 20% cases. But it is the head injury, which is in about 15% and is the most serious problem and causes death. Boys are twice involved as compared to girls. 80% fortunately are minor traumas and they get away with that. But 20% are major. Uncommon traumas, blunt, the direct blow in the perineum like on one side, on the other side, the injury of the perineum after a forceful rape, abdominal wall hematoma because of the heat, seat belt, toilet seat injuries. Very unfortunate, and it does occur. And that is the reason the toilet seats have to be of a special type that must have a protection between the hard sheet and the flexible seat so that there is a gap between the two, and that can avoid this kind of trauma unsuspectedly. The dog bites, other bites that take away the organ. Foreign bodies in the gastrointestinal tract, in the esophagus, in the stomach, or in the chest. Here it is the various spectrum. The child has an inquisitiveness. Coins are the most common, very common. Coin ingestion gets stuck in the pharynx or in the esophagus. Battery cell, nails, and so many other things. Wide variety. And it's very common in our set. Now see the metal clip in the esophagus. But when we talk of chest, the common injuries, common ingestion or inhalation injuries are metallic foreign bodies or the peanuts, anything can be expected. And not only then the endoscopic removal is possible. Okay, thank you so much. Endoscopic removal is the norm, and for that you need not flexible, but the rigid bronchoscopic set. Flexible can remove only very fine bodies and very thin, like the peel of a groundnut. But if it is a groundnut or any solid foreign body, you need a rigid bronchoscopic set. And in such a situation, when there is a nail in the problem is, this is the head side, and when you put a bronchoscope, this has already gone to the extreme and very difficult to catch it and take it out because there is not enough space for the foreign body to expand. Hence, bronchotomy is the answer for that, safe removal. That is the safest way. Very funny, and you see here the bulb of a battery, that's also in the lung. So these are the spectrum that one faces, and so many other things like that. So, all right. What are the newer developments, how to take care of the other major traumas and foreign bodies or the burns? Expertise is growing in the field, and there is an exclusive trauma center in developed world, but in our setup, most of the medical institutions, they have the trauma facilities. So total body imaging for trauma patient, that is a norm. And of course, the targeted management of the head injuries. So this is the situation when there is a trauma to a child that multiple disciplines get involved. I'll talk a little bit about what should be the organization of a trauma setup. Should it be in a medical institution? Should it be a separate? I think the best way how a trauma center should be developed is that it should be attached to a medical institution so that there is a dedicated team to handle the trauma, but at the same time you have the services of a specialized expert from the medical institutes. And trauma cannot feed the special experts, so that a full-time neurosurgeon, full-time cardiac surgeon, full-time pediatric surgeon in a trauma center probably is not justified. Peritoneal lavage, now only limited because of the development of the ultrasound and the fastest that you do the ultrasound in 4 quadrants and find out if there is a fluid or any injury, and only in few cases you will require the role of a peritoneal lavage. This fast can detect the fluid, like this is a normal situation, but this is the fluid between the liver and the kidney, and so also fluid in the pelvis or somewhere. And this is quite helpful these days, and peritoneal lavage is practically ruled out. Okay. There was a time when there was a liver injury and there is a hematoma formation, blood loss, child is unstable, and we used to rush to the operating room and handle it. But now we have learned from those experiences that the mortality is very high. Today, even if there is a liver injury to a sizable extent, conservative treatment can help unless the child is unstable. The blood loss is too much. Same about the renal injuries. For renal injury, there has to be a major trauma, and it is not usually in isolation. There could be associated liver injury, duodenal injury, pancreatic injury, biliary duct injury, and all that. But most importantly is to pick up the cases, like here is a case of kidney injury on the right side. CT scan has been done with contrast, so only left kidney has been enhanced, right kidney is not seen. It means there is a pedicle injury or a severe spasm to the artery is there, and this is an emergency. So this has to be explored and seen if there is an intimal injury to the artery, or there is a hematoma, big hematoma involving, or there is a avulsion of the pedicle. About splenic injury, you all know this is one of the commonest organs to get injured. And this is the contribution from our department. He was my chief earlier. And you know, whenever the vascular supply is horizontal in the spleen, whenever there is an injury, it happens like this. It means the spleen gets injured into two halves, but the vessels, very few vessels get injured. So there is no need to go in and remove the spleen. So conservative spleen, that is the basis of this. And now, I think 90% of the spleens are conserved because of this approach. Here was a girl, 9-year-old, run over by a tractor. 9-year-old. Bilateral contusion, but no fracture of the ribs. Bilateral ventilatory support, chest tube insertion, and became all right. Corrosive injuries are another injuries which are really problematic in our pediatric setup. And this is the series from our past 10 years, 33 cases, younger age group, males much more common. And acid was the commonest problem. Alkali is 12 and acute presentation on 11. So they come with stricture esophagus when they can't eat after about 6 weeks or so. Usually that is the acute phase. Very few cases turn up, but most of them, they die at home or in the hospital at periphery. Only those who survive, they come, and this is the kind of stricture you get. And these are the cases who then require replacement, either with colon or with stomach or with gastric tube. Sometimes there is an acute emergency in such cases. This was a child, inhaled alkali. Here esophagus was burned, trachea burned, so there was acquired tracheo-esophageal fistula with pleural effusion, and so this was a very, very serious issue. It could not be maintained on ventilator, and so we had to do an emergency esophageal replacement with repair of the trachea with several operations and several months of stay, but became all right. Okay. And these are the problems when there is a lower class. Usually the mother usually is not at home. Children just accidentally ingest the acid or the alkali, and that is what is required, awareness, and that is required some precautions while preparing the bottles for corrosive material. So what is needed to avoid such injuries? That lot of education, a lot of awareness, law possibly, that how these drain cleaners and acid bottles should be packed. And then after this awareness, especially there was a campaign in Austria by Professor Michael Hallworth. The incidence of injuries came down from 90% to 20%. It included even how to design a house so that the child hand does not get trapped in the door or in windows, in the table drawers. Some very simple things, but these are very important things. Some time back we held a workshop on all these prevention of injuries, esophageal burns and all that, and our recommendations to the government were that prevention of the sale of the strong acid and alkali is not more than 10%. Prevention of sale of industrial acid as such, and not to remain in the approach of a child. Then the child-proof caps and amber-colored bottles. You might have seen some of the medicines. They are having the caps where you have to press and then rotate. So that child cannot do. It means it is a protective phenomena. And these are called the child-proof caps. And it should be labeled as poisons so that the child has a warning on it. And of course, the Pediatric Trauma Registry, regional and national centers of excellence to deal with such problems, training programs with PALS, with ATLS, ambulance and airlifting services, which are really mandatory because these are all very, very urgent, and of course, the prevention of burns. And needless to say that certainly you have the better roads, but yes, if you go into interior, that certainly requires remodeling of the roads, better quality of the roads, flyovers and school buses. And all these are helpful in prevention of the trauma. Now, more emphasis is being given actually to conduct research in the field of trauma. We very little know about how to handle the child, what is the response of a child after getting the trauma, especially the polytrauma, how much is the immunological response. So all these things, I think, need to be talked about. And now, even in India, there are many research projects going on in the field of research, especially the use of stem cell for spinal cord injuries and other things. Initial results show with the use of stem cells that yes, it is useful, but not in all patients. So I think much remains to be done in near future. With this one, I would like to thank you once again for all your patient hearing and giving me the opportunity to talk to you on trauma. Thank you very much.